Greetings to my lecturer, it's me Sabarinah. In this video, the crop that I would like to present is paddy crop, and the name of the disease that I was looking for is Tungro disease. The main topic I will explain is symptoms, schedules, agents, control method, and the disease impact. Tungro disease identified since 1965 and also known in Malaysia penyakit merah virus and has been identified since 1938 in Indonesia. The main disease also known as Tungro disease. Rice Tungro bacillofluences virus (RTBV) together with rice Tungro spherical virus is the causal agent for the rice Tungro disease. A rapid technique was developed to detect RTBV DNA in a field extract of freshly collected leaf samples by polymerase change reactions. RTBV cannot be transmitted unless RTSV is present. The both virus is present in plant cells. The virus is prevalent in irrigated lowlands. Tungro disease virus are transmitted from one plant to another by leafhopper that feed on Tungro infected plant. The most efficient vector is the green leafhopper. Leafhopper can capture the virus from any part of the infected plant by feeding on it, even for a short time. It can then immediately transmit the virus to other plants within 7 days. The virus will not remain in the leafhopper body unless it feeds again on an infected plant and require the virus. Let's start with the symptoms. Tungro infections can occur during all growth stage of the rice plant. It is most frequently seen during the vegetative phase. The most common symptoms appear first on the emerging leaf. They are also seen started with slight reductions in tiller number, and the symptoms appear in lower leaves. The symptoms on the leaves show yellowish and orange discolorations in intervernal florets, that is loss of chlorophyll. They are turn yellow-orange, then downward poses dark spot. Other infection symptoms is the young leaves are sometimes noted while rusty spots appear on the older leaves. Once a rice plant is infected by Tungro, it cannot be cured. Preventive measures are more effective for the control of Tungro than direct disease control measure. Using insecticide to control leafhopper is often ineffective because green leafhopper continuously move to surrounding fields and spirit Tungro rapidly in very short time feeding. The most critical measure include planting of resistant variety agents Tungro virus disease is the economical means of managing the disease. There are Tungro resistant variety available for the Philippines, Malaysia, Indonesia, India, and Bangladesh. Practice synchronized planting with surrounding farms. Delay or late planting relative to the average that in a given area can make the field susceptible for Tungro. Late planted fields also pose a risk to yearly planting in the next season, so adjust planting time to when a green leafhopper are not in seasons or abandoned. Plowing and harrowing the field to destroy stubble right after harvest in order to eradicate other Tungro hosts are also advisable. Some chemical method that can be used by spraying 2% urea mixed with monocozops at 2.5 grams per liter can be minimize leaf yellowing. Instead of urea, foliar fertilizer like multi-potassiums can be sprayed at 1% which impact resistant and also because higher potassium content. Moreover, by practicing the light traps method can attract and control leafhopper better as well as to monitor the populations. This is should practice every day. The huge impact of this disease for yearly infections can reduce green matter and cause yield losses up to 68%. And some Tungro infections causes similar breakdown of chloroplast lamellae, resulting in premature senescence. Tungro infected plant also show of stunting, delay flowering, which may delay maturity, reduce number of tillers, small and not completely exerted panicle, as well as higher than normal percentage of sterile panicle, or partially field grains covered with dark brown blotch. That's all from me.